but most of the branches, like some of the ladies are dealing with trauma. So these are the very odd, long working hours. And always right from the beginning as a child, it has been imprinted on us that the men are supposed to take care and earn the money, and the lady is supposed to look after the family. So that battle of emotions is always in the minds of all the ladies, that if I am too busy with my career, maybe I will be very successful, but I will, I will be doing harm to my children and their upbringing. So this thought that this responsibility of home has always played a part on the minds of all the women. And that is the reason why they want to balance the family and their professional life. And with other branches with not so unpredictable working hours, I think they would prefer those branches over to surgery.
Yeah, thank you. Dr. Nanda, would you have some other reason for this? Or you would
I think when we had to take up surgery as a specialty, I never thought I want to take up surgery, because looking at surgeons, their work, the way they spoke, it never influenced me much. So one is the role models were very less at that time. Even now, there may be more role models, but still, by the time the women has to take up either surgery or any post-graduation, she may be about to go in for making a family, whether to be with her husband's family or to be with, to have children. Already maybe she's married. So there is going to be an extended, a different family, and she has a lot of thought process. Will this specialty apply to me very well? A lot of time, obstetrics and gynecology is thought to be very much applicable to women because they always deal with women patients. So the family may not also, maybe they may say, oh, you're always dealing with men patients if you become a surgeon. Now we do know that, yeah, there are men's problems also which we deal with as women surgeons. So I think this is a thing in our minds that is imprinted during undergraduate course itself, that it may not apply to me. So it is not that I take up my post-graduation into MS surgery just by seeing what surgery might help us and how it may take us forward. Also, how it might apply to my personal life. So this also we look at it. So I think this is a reason they don't take up surgery, I think.
Okay, thank you. So there is a kind of built-in belief that it is a male job.
Yeah.
And
yes.
a woman is going to become a surgeon at risk to her family life, probably. It probably may not be accepted by the family.
Because at that time, she's definitely going probably into a new family, because 99% of the women surgeons do get married, though one may not get married, but 99 of them do get married. And she will also think whether being a surgeon, will it help me to be helpful to the family too? Because women have to do both and the work also. So that's how, because as everyone was saying, yes, we are taught to be taking care of the family, children, and work. So it may not apply to all three. That's what we think. So, but yes, we are going to discuss forward on how it can be helpful to even taking up surgery as a woman. We'll discuss that.
Well, I think this is common to all the working women. I mean, my wife also used to work. There was so much of work that comes on to the family members. So I would think there is just not about family, because it's common to everybody. Even if it's a pathologist, she still will have to look after her family. So except for that,
pathologist doesn't have odd working hours.
No,
Pathologists don't have odd working hours, like teaching jobs and pathology, and these are all cold branches. So you cannot compare those branches to a surgical branch.
I think lot of work that is related to excessive physical field itself is not considered to be for women. Because let us say she cannot become a construction worker, like how we see a lot of manual workers to be men always, not women are there. So it is a male dominated field. So similarly, even surgical field is supposed to be male dominated field, especially during training. There is an aggressive physical work that is required, especially during training, I must say. Later, we always have a choice what not to do. But during training, I don't have a choice. I have to do work like exactly how the other male colleagues work. So this is the reason I think we think a lot if I have to become a surgeon. Yeah.
Thank you. Now I'll ask Colonel
Baskaran, if I just can chat in, you should excuse me. Is it difficult to work with men? Now that the seniors have worked with men for so long, he can add that bit here and there. You should speak the truth.
Can I answer that question?
Yes, madam.
Yeah. For over 4 decades, I have right from 1979, I have been working in this field of general surgery. I should thank all the men, my professors, my associates, my students, and all my colleagues. I thank them. Today, I stand here as a very successful surgeon. It's because of them. They encouraged me in every way. There was no kind of any kind of a harassment which I faced. They always encouraged everything I did. I was appreciated. You know, that kind of an encouragement, especially from the students level, and no criticism whatsoever I had from my colleagues or my professors. All that they said was, you're good, and it's nice to watch your surgery, like that. I'm sure all the women would have had the same feeling.
I'm sure you must have been good. There is no reason why they would say you're good just for the sake of it. So you were good, and I think that
no, I do not know. I do not know. That constant encouragement made me work harder and harder, and I have come. So I thank all the men whom I have met. Now I will never say anything about even a single male member was not sort of unkind to me, you know. And I am blessed.
Maybe you are too good.
No,
no. I am blessed. I am true. I'm sure all these women would have been very, very good. No, they are so successful.
Madam, exactly the reverse opinion I got from another person who is not a surgeon, but he said the surgeons are mean people. Anyway, now
Baskaran, male surgeons are mean people. Is that what you mean?
No, sir. No, sir. No. I would never ever say that. You know,
I like to agree with you, madam, because I have also had a similar experience. Just to tell you one example, if you go to doctor's lounge, in the surgical lounge, they're mostly men, and let us say I'm the woman sitting there. The topic of discussion won't be the other people, because women, they focus on the interest of the people, but whereas men, they're only discussing about either business, sports. You know, the topic is very different. I think this made me, being with men around me all the time has made me more a knowledgeable person than I would have been ever. I must say that. I really thank men who have been, you know, professional colleagues of mine. I think I've learned a lot, of changed my attitude, because I come from a women's boarding school all my life.
Yes.
And this really, I must say that, you know, it really totally changed my attitude, perception of life itself, just being around men.
And also I would add here, you know, when we were in Government General Hospital, there were a couple of surgeons, you know, when they were doing very difficult surgery, they did not have any ego. They called me. When there was a difficult surgery, a bleed or a dissection which was there, which had to be tackled, they never hesitated to call me and give them a hand. So many surgeons I have helped like that. You know, they never hesitated at all. So I think, I do not know. First, the women have to be knowing their work and their job well.
Absolutely.
If at all they're criticized, it is their own, probably some kind of lapse on themselves, rather than blame the men for that. You know, that's
no. But I must ask you, men over here, what do they think of women around them as a surgeons?
Yes.
We will have a different discussion with men first.
That's a good thing. But you know, I like to say
at all.
something here. I like to say something here. A lot of my men colleague surgeons have told me, like, you know, if they've seen me as an undergraduate also, and if they've seen me as a surgeon postgraduate, they've even said, "Oh, Nanda, you're such a nerd there, and you behaving like so flamboyant." Probably we change our attitude and the way we behave by having a lot of men around us. That's what I think.
Okay. Sir, I think, sir, that females, they have the habit of taking an undue advantage being a female. And when it comes to the icing of the cake, they always want the icing of the cake, and the bottom work, like other departmental work, uh, other works which cannot be handled by the female. In that also they require some contribution from the female. And I think that it is not a differentiation that a female is inferior to a male. Always in every department of the surgery now, almost across the India, in every department many of the females are working as the head of department. So it is I think not a question right now whether a male is helping or not to a female for the departmental help. So it is always a fruitful environment and a working environment always, sir.
Thank you. Now,
Baskaran, I think I derailed the wagon.
There are some questions.
Yeah.
Yes, Radha. You know, there has been some questions raised by some of the people who generally tend to disagree with generalization that men are good or men are not good, women are good, women are not good. So all kinds of permutation combinations actually exist. There are some men who are terrible. There are some men who happen to be good. Similarly, I am sure women also. Majority may be good, some may not be really that good. Nevertheless, let's ask this lady who has broken the glass ceiling and has gone to liver transplantation, renal transplantation, deemed to be one of the most demanding, toughest surgical specialties. Dr. Gomathi, what would be your views about not only breaking into transplantation, about how fellow male surgeons treat women surgeons and vice versa?
I think I agree with most of what has been said, in the sense it is about individuals rather than trying to look at it in a gender-based manner. Even for a guy, if you were to establish yourself in a demanding field, you will have to prove yourself. You'll have to stand up to what you've been given, your responsibility. Same holds good for a woman too. But of course, when you are going to establish yourself in a field where there are not many women, you need to do that extra bit. There is no doubt about it. But the initial years are more difficult. Okay. Once you're able to have clarity to yourself and establish the same among your peers, saying you mean business, then it's only profession. It depends on how professional you are and what you do. No favors expected, no favors given. Very easy.
Excellent. Excellent. Thank you. It is. I was discussing with Dr. Tichan Lama that whether she needs to put in little extra effort to do better than men. She said that is the least of the problems. May I request Dr. Lama to come up and give your opinion about how to have this gender discrimination based on capability in surgery to be removed.
Can you hear me?
Yeah, very well.
Okay. First of all, thank you for inviting me. Yeah, that's Kanchanjunga at the back. Yes.
Excellent. Yeah.
So thank you very much. This is a very august gathering of women surgeons, and I'm extremely, extremely proud to be in this gathering and to be even asked to speak amongst this group of, acknowledged women in their fields. I really appreciate it. First of all, I would think that most of you have reached the stage where you've forgotten your residency and you've forgotten that they treated us very badly. And they didn't just treat women badly, they treated all their residents badly. So that was the leveler. So, once you got level with that aspect of it, that, okay, your male colleague is as badly abused as you are, and you just move on. I mean, you have no time, like Dr. Gomathi said, there's no time to sit there and feel sorry for yourself because you're a girl or you're soft-hearted, because, well, you have to just plod on and do your work. And yes, it is physically taxing. However, I do think that once you have reached a particular stage and age when, you want to choose your super specialty or what you want to do in, then things just fall into place because you are older. You are able to take decisions where you don't get so traumatized, so to say, as a 22-year-old or a 24-year-old. So I think once all the ladies have crossed that particular age when they've accomplished something, then they're not going to think too much about what happened in residency and all, because, that's way past. And you see that everybody else has pretty much suffered the similar kind of a life as you have. And this is what I'm saying at the best of institutes. So, professor said that she had everybody encouraging her. I would think that we would get encouraged by being asked questions and being told a few nasty words that was encouragement for us to go and read more and to understand that yes, it is a very tough surgery. I don't remember any senior consultant or professor coming and apologizing to us for shouting. I see that big change today, that if I feel that I've been a little bit harsh on my junior resident or my senior resident, at the end of the procedure, I do go and I say, I'm sorry that I said this to you, but I was in a very difficult situation at that time. And I think that they are also gracious enough to accept that. That is a very big change that I have taken onto myself, to be able to understand that the person who is there is trusting me to be able to teach them something. And I appreciate the fact that they probably take something away, like our seniors did. So our seniors were from a generation where they had patriarchy. We still have that, but it's so much has changed. So today I feel that a lot of women are shining because they like I talked to you earlier and I said, it doesn't matter if you have to work a little bit harder, that's nothing. But what is the main thing I see today is that a lot of people, even men, don't want to take up surgery. Forget women. In fact, the number of women who take up pediatric surgery is much more than any other subjects. So to have people who are bariatric surgeons, oncosurgeons, and laparoscopic oncosurgeons, and Lieutenant Colonel who's there in Sudan leading the UN peacekeeping force. I mean, you give a particular role and a woman rises to the occasion. So today, I think that we don't talk about literally as to the gender of the person who's joining surgery as such. We just want more people to join surgery because we don't have many people joining surgery and not really interested in doing even, specialized surgeries like pediatric surgery and cardiac surgery. So there is a big lacuna, and that is because the younger generation has realized that these are labor intensive. They're not interested. It's a different world. So I think we have to encourage surgery, not only for women, but surgery as a whole for even young, talented men, both sides. So I believe in feminism being equality for opportunity. I don't believe in, shouting at the rooftops, because that's not how I was brought up. I wasn't brought up saying, oh, you can't do this because you're a girl. I was like, do whatever you want. So I had this harsh reality thrown in my face when I was actually told, okay, you should think about getting married. I was like, huh? Really? It was a shock to me. So I don't know how many fit into that kind of life role that I had, because I didn't have so many restrictions that a lot of my friends who were doing surgery did. Plus, once you are a mother and you have children, there is the guilt factor. They take time off. My friends have taken time off to look after their children, and perfect. That's their choice and perfect. They've come back once their children are older, but those people always have a few regrets that they were not able to, do as well as their male colleagues, because they lost that 5 years, 10 years time that is there. So for me, it's not only about women taking surgery, but the opportunities that exist for women. Why can't it be that women can do part-time? And that is something that I saw in Australia. As residency, they were allowing women to do part-time. And I don't think that is taking a role and saying, oh, I'm woman, so give. I think, why not? That's my take on it. As in, like, why not? And that particular person is the head of department in Monash University in pediatric surgery today. And had she not been given the opportunity to do three days a week in 2003, 2001, she wouldn't have reached this place. So I think as women, we have to be, and it was strange to me at that time because I was like, aisa bhi hota hai. But I think this is something that we also have to break the patriarchy we're in. Like we are also in that thought process. We have to break that thought process and say, okay, why can't we do that? It is acceptable because, when you are less than 30 or 35, 36, it seems to be all such a rushed kind of everything has to be done at that particular age. But when I went abroad, I realized you didn't have to finish by a particular age. You could do it older when you're older as well. So I think, yes, of course, people will talk about having children and all. I'm like saying, yes, have the children, come back and work. It doesn't matter. Have the children take half time off and come back and work whenever you feel like. That's also there. So I believe in equality, in opportunity. You have the degree, you can pursue it anytime. You're not a has-been just because you're out of the sector or you've been sitting at home for 2 years. So somewhere along the time, I think work-life balance has to be on the basis of what the lady wants, literally what she wants, and not what somebody else imposes on her. So, I mean, that's my 2 bits. Sorry for speaking so long.
Excellent. Thank you. Thank you. So you are telling me to be a devil's advocate. Why should women join surgery is the question you are raising. Why should men also join surgery?
I'm saying
If
no.
we are going to be working like a donkey and going to be treated like a dog and going to be paid like a monkey with peanuts, obviously nobody is going to join surgery.
Exactly.
Yeah.
Exactly. And today we have people telling me that, you know what, robotics is going to take over and AI is going to take over. And I'm sitting there and thinking, okay, I think I'll be working for the next 30 years if these are the people who are going to be saying that. So I envision that for myself.
It will happen.
Yes, yes, absolutely.
People from Lakshmi joined, Lakshmi Kona.
Yeah.
Oh, Dr. Lakshmi, welcome.
Hi, Lakshmi.
Hello.
Yeah, so we were just talking about why women are not taking up surgery, and everybody said the obvious reasons. One, it is deemed to be a male-dominated one. They don't feel very comfortable. The family does not want them to spend extra hours in the hospital looking after patients and such things. And obviously, you don't get paid that well for the amount of work you do. And in many departments, you are treated very well. All the institute is known. Residents are going to be treated like dogs. So that is obvious. And they are the people who get kicked around. I remember Dr. Radha and I were together in All India Institute. At 1:30, I saw a cardiology resident going around with a thick sheet of 30 referrals for pre-operative workup. I asked him, don't you get sick of this? Don't you feel like tearing it away? He says, I feel like tearing it away every day. But I know if I don't go see the patient, behind every paper there is a resident and he is going to be kicked next day by the faculty. Poor chap from 2 to 5 in the morning would see the night patients and clear them for surgery. So that is the kind of life All India Institute is known for. And that is why the residents are the backbone of that institute. So that kind of residency probably you don't have in many other hospitals, certainly not existing in Tamil Nadu. Anyway, now that we have come to this, it is obvious the work-family relationship has a great influence on women rather than men, because men don't look after children, men don't do dinner.
Partly disagree, Baskaran.
Yeah, pardon me.
Okay, carry on.
So, if a lady is to look after the family, kid, or an elderly mother, or some other dependent person, she will have to find means to continue her surgical career. Now, can I ask Colonel Geeta to come up and give her opinion about how to manage this work? Work in the army, is very difficult. So we are not going to talk about it. So it is going to extract more than a pound of flesh from you. So how do you manage, Colonel Geeta?
Thank you, sir, for giving me the opportunity. And since I'm speaking for the first time, I must also tell the audience that the person who held my hands while I took the baby, thankful to him that I'm here today with this August gathering. Now, regarding the question of the family and work balance, yes, it is all of us. I mean, all of us have a family which with children, with dependents. I think one has to be very lucky to have a very supportive family. And because surgery, as all of us have now realized, is a demanding specialty, and how we balance the work and home is, I think, more of grace and luck than of our efficiency, because things have to fall in place. Otherwise, it can be very difficult for a surgeon. And that's how life has been for me. Like, I have always had somebody to look after, somehow to look after me, even at workplace. Like somebody, Madam Shruthi was mentioning that about the male surgeons in her life. Actually, for me, I was the only lady surgeon in my batch, and I was looked after like a princess. So it was just because of them. I was looked after so well that things were easy for me. And then I had, by God's grace, a supportive family, so I could manage things well. So I guess it is luck, and to some extent that how we can manage this work and family life. That's what I feel, sir.
Thank you.
Baskaran, Ilango wants to make a comment. Ilango, please.
Sir, it was not a comment. It's a question.
No, just put on a camera.
I'm in my t-shirt.
Yeah, that's fine. Yeah.
Everybody's talking about supportive colleagues, supportive family to be the backbone of a woman's surgeon. I think it is every woman physician's need of the hour. You need supportive colleagues. I think it's the same for everyone.
Can you speak a little louder? Ilango is not very loud enough.
Not very clear, sir.
Yeah.
Okay now.
Better.
The inspiring story is about Dr. Nancy Asher, who is from the University of in UCSF in US. She was one of the transplant chiefs. She was trained at the same time, just after Starzl at the University of Minnesota. And I've heard she had the guts. She was holding one of her babies while she was giving one of the cross-plenary sessions. And she stepped down to see her child sleeping, and she got out of the dais, picked up the child, left it in Starzl's lap, and continued the plenary session. That was the kind of balance she achieved. She was very good. It was very inspiring to hear. But that's only one story. All along, we have seen numerous colleagues who have fallen off the grid despite having excellent, promising careers. One of my colleagues in MS General Surgery was from Dr. Beena from Trivandrum. She was the go-to person for complicated stuff. Beena would walk from the ladies' hospital in the middle of the night. All the PGs knew that Beena was excellent. She started her career in neurosurgery, and for some reason she discontinued, and she went on to become a general surgeon. She joined a hospital, and after that we lost contact. She was one of the promising surgeons whom I have felt lost right after the beginning of the family. What will you do in the absence of a non-supporting family? Or the other way I would put this, what would you do if your spouse is not a doctor? How have people managed that? That's my question.
I don't think it should be difficult. Dr. Lakshmi, can you answer?
Means he says that you don't have a supportive family,
yeah,
or a supportive family. You means, I would say, if it's a non-supportive family, it could be the marital family which is not supportive of you. But I am sure if a lady has chosen surgery as a field, then I'm sure her parents would have supported her till that time. And I think, I say in my case, my parents, my father and mother have supported me and are supporting me. My dad is no more, but my mother is with me. All throughout, they have brought up my kids. And it's not that they have stayed with me, and I have looked them to their old age and to their illnesses and all. So it is that one set of parents will surely be supportive. It may, if the spouse is not, see, and I'm saying to any girl that when you have dreams of doing something in life, you should talk all this before you agree for any marriage or anything. I would feel that first put your ideas to forth. That look, I am interested in career and I am picking up surgery, which is a demanding field. So it would require me late nights out, or I may be on duty for a couple of days, so I may not be coming home. So first, why don't the girls sort it out there? Because for anyone, someone wants to be a pilot, so she should be able to convince the family that her work needs that, and then if the partner is willing, then you go ahead. It is that the girls first, what they see is, am I going to get a comfortable life or not? That is my understanding of why most of the girls are not doing well beyond a certain thing in medicine, because they see that, am I getting a comfortable life? And will the boy able to provide me? Are my in-laws able to provide me? When you're not putting your forth, like, look, this is my ambition and I want this from life, then let the boy also decide whether he wants you or not. Then otherwise we also can choose a different person. So when we make our choices wrong in the beginning, where you want to project yourself that I want to be a homely lady and I want my needs to be taken care of by a boy, well and good. But later don't pop up and say that, look, now I want to do surgery and I have late night duty. The boy is not mentally prepared for your activities. So first, any girl should be trained first to be assertive at what she wants from the life or from the future family. then I think it will be easy for the girls to succeed in field. Lot of girls fail because neither their parents have brought them that way, or these girls themselves have made the choice in such a way that let me first find a comfortable life, I get everything, and then I'll think about career. Then I think about career never happens. A boy starts thinking about career when he finishes his internship. They're very aggressive. That's what I've seen. I have handled so many boys, training them for DNV, FNB. I've understood the boys' mentality better. They know how I learn my livelihood. I have to take care of my parents. I have to take care, but most of the girls are not brought up that way. You get married to a rich, wealthy person, that fellow will take care of you. And then your career ambitions come in and they clash. So I think girls, first it is a parent's thing that if you want your girls to shine in life, you have to make them mentally prepared that they have to work. And sometimes you may not get all the luxuries in the beginning of your career, but be prepared to trade for things once you start working and you yourself can afford the luxuries. I think that is my opinion. Understanding through almost 30 years through surgery, training students, why girls falter and why boys succeed. And even among the boys also, there's a lot of backbiting, leg pulling, and it's a struggle. So if we girls can just think, I am also a boy, I am a neutral person, and my aim is to do well in my career, along with that support my family, then we'll do well. But at some time we falter and we feel that I didn't get my friend got married to so and so man and he provided so much and you're not providing. So that fellow will say, you sit at home, I will go and provide, look after the kids. So it's a give and take.
Thank you.
Just permit me to get a question or two from the audience. Manjula Rao, what's your comment? Because we also need to have some trainee surgeons to comment at this juncture, not just the successful ones. Yeah, Manjula.
I can't hear you.
You can't hear her.
Yeah.
Can you hear me now?
Yes.
Yes.
Good evening, everyone. I'm sorry I wasn't prepared for this. I'm actually taking a walk outside, but I do have a comment. Ma'am, with all due respect, I agree that one needs to think ahead and one needs to explain every foreseeable conclusion to the prospective groom or their parents in case it's an arranged marriage. But more often than not, what seems very acceptable at one point may not be acceptable in the future when they are faced with the reality of the situation. I have seen it happening with a few friends of mine where initially the glamour of having the boy married to a female surgeon seems to be good enough for them. The so-called respect that one gets in society. However, later on, when faced with the reality, when she has to answer night calls, emergencies, when she's not at home to look after the kids or take care of duties expected of her at home, it's not seen in the same gender's light. Sorry.
I have one comment to make on this, Manjula.
Yes,
the very fact that you want to balance your family life and your career, you have to be ready to take a backseat when the family demands your presence. This is what I have followed. And it should come from the husband as well as from the wife, if she's a surgeon, that I'm a surgeon, I want to pursue my career, but do I want to do it at the expense of my children going haywire and not, behaving themselves, or, their career is disturbed. So sometimes, like what I did when both the daughters were in 10th and 12th, I stopped my evening consultations for the last 3 months because I wanted to be at home when they came back from their classes. Because they knew that mother is there when they need it. I wouldn't be there for the 9 months. The last crucial months, I was there. So this understanding has to be there for both the husband as well as the wife. And one has to learn to adjust to one's needs. Take a back seat whenever is required by the lady as well as by the husband. So that is the crux of a very happily married life, because we have chosen to get married. Okay.
True.
We have chosen to have bear children, or people who would want to just go ahead with their career, they should not get married. They should make it very clear that they do not want to have children right in the beginning. If you want to balance everything, you have to have mind which will adjust to these things.
True. If I may be allowed to comment. Yeah. So I agree with you completely, ma'am. I think that's where that's where choice comes in.
Yeah.
So once we are mature enough to identify the lacunae and identify what is preventing us from getting ahead, we need to take stock of our priorities.
True.
And if I may speak personally, I have a lot of extracurricular interests which I had to stop due to my training. I was not keen on running the rat race. However, I still like to be good at what I do. And that's the reason I am focusing on my passion, which is breast surgery. I have trained in the same, and I've now made a career out of it. So I think that's where choice and priorities come into play. Yes, ma'am.
Sir, I want to make a comment, sir.
Yes, please.
May I, sir? Now, in the work and the family balance, sir, I was fortunate enough that my husband is an anesthesiologist, sir, and my in-laws have supported me like anything. So I am the luckiest person on this universe. I always pray to the God and thank to the God. Now, why I should say this, sir? Because in the process of over 19 years practice, in these 19 years, I have decided that surgery is not the end of 3 year or 5 year. It is not going to be the end point. It is always a continuous learning process. So in this learning process, sir, you always require your family members' support. Until your family is happy, you cannot work happily. That is the basic principle, sir. And in this mission, sir, I apologize to every female that when you able to convince them that I want a continuous upgradation while working, so that I can continuously progress in my work and earning as well. So in this era, you will with the passion within you, and if you are able to convince and the continuous passion within you, and I was lucky and fortunate enough that my husband, my in-laws have always supported, and until this year, sir, before this COVID era, every Saturday and Sunday I am out of the town to learn something. May it be Jain Hospital at Roy Patankar, may it be at may it be at Pune, may it be at Tata Hospital. So this has made me a stronger female, sir. And my family has accepted that Mama is not going to meet us on Saturday and Sunday. I am working in the various associations, sir, like MASI and various associations like APSI. But the male colleagues which are there, they always have asked me, Anjali, how you balance your life? So I always say it is always a give and take phenomena, sir.
Thank you.
Baskaran, one comment from Dr. Shruthi Reddy from the UK, and then we get back to you. Dr. Shruthi?
Hi. Am I audible?
Yes.
Yeah. Thank you, Dr. Pata and Dr. Baskaran. My name is Shruthi Reddy. I'm a transplant surgery trainer.
Can be a little louder, please? Yeah.
Yeah. I'm sorry. Is it better now?
Yeah.
Yeah. I'm a transplant surgery trainee. So I've finished my GI HPB training back in India and All India Institute, and now
We can't hear you properly. Can you talk a little louder?
I'm sorry, I'm in a public area. Is it better now?
Yeah. Yes.
Yeah. So what I wanted to give a different perspective. So I entered my surgical training in 2010. I did see much lesser women in surgical training back then compared to what is happening now. There's a lot of good work being done. There are more women taking general surgery as a subject. We have, I believe, conquered the first step, but then it should always be an ongoing effort. But then what I feel is what has been achieved should not prevent us from what needs to be achieved. There's still a lot that needs to be achieved. So from what I see, so among the women who take up general surgery, it's most of them, when it comes to choosing their specialization, it's usually one of the women-friendly specializations which is sought after, even though, so as most of the senior surgeons said, most of them take general surgery with a lot of passion, but then when it comes to choosing the subspecialization, they want something which can support their family life or their other obligations. So because of that, it's usually plastic pediatric, breast surgery, or general surgery to again cater to female patients. These are the ones, these are the, most sought after subspecialties for general surgery trained women. So that needs to change, and it is kind of changing. There are women who are taking up neurosurgery, CTVS, GI surgery, orthopedics, or urology, etc. And things are changing. But then when it comes to, again, so the first step is training, which I believe we are conquering that part. But then when it comes to practice, again, I would like to make a specific mention about private practice, especially in metros. Many of the senior surgeons here, the panelists, are, I see from their profile that they are, practicing in metros. But then from what I see is there's a usual tendency for women to, prefer medical college kind of practice. This is again to avoid all the dirty work which happens in private practice. Like most of the times there's a lot of slandering. I'm not saying it's a specific thing, but then, there's a lot of cutthroat practice in private. And when it comes to women, slandering from either the male colleagues or just anyone, even the management, it's much easier to eliminate competition that way. There's less of respect, less of obedience, which they get from their subordinates. There's less of collaboration with, the male colleagues. It will take some time for them to, it will take a lot more effort and a lot more time than an equally qualified male surgeon for the women surgeon to be recognized and to be, taken into a group of male surgeons. There is pay inequality. This needs to be acknowledged. It's a known thing. It's a known thing all over the world. It's a known thing in India. And there is less of support from the private hospitals, like corporate hospitals, when it comes to leading something. And I'm talking about really challenging fields. Again, if you have to lead a team, if you have to get marketing support to, to sell yourself, to get more patients, there's less, women surgeons are seen as less, not very appealing for the masses to, to sell them or to market them. So this, I feel, is what is actually happening. And this, I've spent very little time as a consultant back in Bangalore when, this is the time between my MCH and before I came here. But then I have seen other women surgeons who have faced this kind of issue. And somewhere I feel we need to also address these things and not just tell ourselves that we have achieved quite a lot. So this is my opinion, and this, I believe, is the opinion of a good number of people. Again, I'm not generalizing anything, but then these things do exist, and this is based on gender, and something needs to be done about this. I would like to hear the opinion of the other panelists about this.
Yeah, thank you.
Can I answer that too?
Reddy is that it may not be level playing ground for women, but then it is for everybody. A corporate hospital identifies people, irrespective of the gender, who is going to bring in revenue. It may be A, B, C, D, anybody. There are some people who are powerful enough to tell the corporate hospital to do what they want. Okay, this is going to be this is the first among equals situation.
Baskaran,
that can't be changed.
Baskaran, please, Shruthi has come up with certain problems. We need solutions from the senior panelists.
True. We'll raise
you
that.
And me can't give solutions, Baskaran. We are on
still,
the other side. We are on the other side.
Dr. Vasudevan's comment, I do agree that corporates would see things in a different way. But then to say that they see both men and women equally when it comes to portraying them as leaders or selling them or marketing them, I really doubt if the rest of the senior consultants here would agree with that. And they are, I still think they still want to portray a male surgeon as a team leader rather than a female surgeon.
I'll get to the panelists, but as an observer, I know the corporate hospitals do recognize talent. Dr. Lakshmi, for example, Dr. Jyotsna, for example, Dr. Nanda, for example, their hospitals will bend their back to do things for them.
Yes, sir. I'm talking about other challenging, I'm not saying those are any less challenging fields. I'm talking about maybe a neurosurgeon, a CTVS surgeon, a transplant surgeon, these kind of fields where, you know, the general mentality of the people, of the patients is that these are, oh, bigger surgeries, we need to go to, you know, more senior doctors or more experienced doctors. When it comes to that, somehow it's the male surgeons who are being sold,
Shruti,
which is kind of,
Let's ask Dr. Gomathi.
Take a minute.
Let's ask Dr. Gomathi.
No. Just a minute, Baskaran. We'll hear from Dr. Lakshmi, Dr. Jyotsna, and as to how they become big when they face all this trouble in the corporate sector. How could they? They may have some solutions.
Okay.
First of all, I was never in a corporate hospital. Okay, initial days I used to be attached to few hospitals in Pune, and that's where I would take my equipment and do surgeries. What I want to tell this, sorry, I forgot your name, Shruti, is that you have to have a niche, you have to make a mark. Being a female in a male-dominated field, you have to create your own space. That is very important. And then there is no looking back. They don't look at you as a female. If you're just an ordinary surgeon, yes, being a female is a disadvantage. And that's the very challenge that to which we have to come up to. Okay, you have to be special. You have to go run an extra mile. You have to raise yourself. Only then they will realize, oh, there are 10 male surgeons, but she's different. And this extra effort we have to do because we are, you know, in a field which is dominated by men. And then once you prove yourself, there is no turning back. They will respect you. They will, you know, go out of their way. They will do anything because they know what you are worth. And that is true for any field for that matter. It may not be a doctor. You have to create your own niche. You have to command respect and not demand it.
Can I ask you something in this, ma'am? Creating a niche is easier when you're targeting female patients. As a female surgeon, if you're targeting female patients, creating a niche is easier for the hospital. But then otherwise, if you say that, no, I want to be treated equally and I want to make my mark as a good surgeon and not as a good female surgeon, which is what the intention of most of them.
We don't want to be known as a female surgeon. No way.
Can I also comment? I think I would agree with Madam what exactly she said. I've been practicing for 40 years now. And I started only in general surgery. I did not do any general practice. I focused myself, I projected myself as a general surgeon. I have done almost everything, and nearly 60% of my patients are male patients.
True.
They have come for hernia, they have come for everything.
Exactly.
What is the secret, Madam? What is your secret?
Pardon, sir?
What is your secret?
Nothing, sir. You project yourself. You tell them that I can do it and my results are like this. You will just go 100% fine. If at all, you can speak about the complications also, but then you project yourself, and then if you are giving a result that is much better than what he has expected from you, definitely he's going to get his family, he's going to get his friends. That's how I increase my practice. Almost every surgery I have done outside. I have not depended on any corporate hospital for me. I developed my own practice, and the places where I am doing, they are benefiting from me. The patients come for my sake.
Initially, the patient will see the confidence with which you talk. Exactly. Of course, just good talk is not enough. You have to also have good results.
Like I would not agree with much with if a lady, they are only doing lady surgery and ladies cases only. Women related surgery only. It is their own folly because they are just succumbing to that.
But then that's the reality in private practice.
Certain places, madam. But I would request you to bring you project yourself.
That is the only
and speak to them who are capable of doing this and give necessary results.
I don't disagree. That is the strategy. That is the plan. That's what everyone needs to do. Just that, you know, somewhere, because I thought after listening to the 1 hour discussion, I felt that these topics need to be addressed, recognized, and acknowledged. It's not that things are getting better. We have the support, we have our male colleagues and professors who support us, but then somewhere it's not totally equal yet, and we need to struggle, we need to strive for that absolute equality. You know, we may not reach the absolute, we may not reach the perfection, but then at least we'll get better than.
Another point I would suggest to you. Suppose,
Yes.
you know, somebody had written here, a female surgeon, a female patients will prefer a female surgeon. Well, if a female comes to you, you also tell them, the family, that you are capable of doing all this kind of surgery. So they get their spouses also to your help. They'll come to you. That is the way to bring up or you know, build up your confidence level.
Manjula, what is your point?
My point is that the world is not a just place. That everybody knows. Just because you are good, you are not going to be recognized straight away. It takes more effort on your part, irrespective of the gender. I'm not talking about gender.
That's exactly true.
You have come up in life. I have come up in life. It's not because of gender. You have come up because of your work. I have come up because of my work. Nobody gave me a place on top level because I am a male. Nothing like that. So it cannot be expected from a male or from a female.
And Shruti, you make yourself prominent by recording whatever operations you are doing, presenting it to various bodies and meetings so that people are aware of what you're doing. Otherwise, it's something like jungle mein moor nachak kisne dekha. If your work is good, it has to be projected. That extra effort you have to take.
Ma'am, end of the day, I mean, as a super specialist surgeon, and when I look at other people, like there are quite a few CTVS surgeons who are women in India. There are quite a few neurosurgeons who are women in India. So not all of them you see are as famous as, so, I mean, so general surgery.
Nobody becomes famous automatically just because they have taken these different branches.
No.
You have to do that effort.
I'm not saying that.
Yeah.
They are very passionate. They are very hardworking. Just that the coming to the forefront, opportunities are not, I mean, there is still a bit of hesitation.
I don't think it is the opportunity. I think it is, some people are just happy doing good service to the mankind. They are having excellent results, but they are not interested in becoming famous. If you are interested in becoming famous,
you mean to say all of the, you mean to say all of the neurosurgeons, CTVS surgeons?
Yeah, your point is well taken. Shruti will give others to come in. Manjula, your point, then we'll go back to Baskaran.
Yes, sir.
Yes. For a while. Manjula, your point.
Am I audible?
Yes.
Yes. I agree with Dr. Shruti. I also believe that I don't like to complain. I believe we have to face our problems and look for solutions. However, one must face reality. Gender bias is there in the field of surgery. It's considered a male-dominated field. We all must work hard. We all must put in the inputs. However, I have seen and I have experienced that a woman needs to work twice as hard to make the same impact, to create the same impact. So I agree, we all have to put in the effort, but it is harder for a lady, and I'm not cribbing about it. I have identified it and we have to work towards it, but that is the reality. It's a sad reality.
Yeah, I agree totally. You have to work much harder, no doubt.
It's basically like you get into a sport, you know the rules.
Yes.
And the rules when you get into surgery are, it is tougher. So you're there understanding what it is. So beyond that point, we have to accept there is no point going back and saying it was a difficult game. It is going to be difficult. We signed up for it.
Yes.
How do we move forward is the question.
True. I just wanted the panel to acknowledge, and you know, most of you have eventually have that there is still some, you know, bias and some hindrances, which should be a constant. I mean, we should constantly try and, you know, work on neutralizing it.
Shruti, we do accept, the society knows. The issue is not with the male surgeons or with the female surgeons. Now let's ask the senior people. Aparna, all of you know Aparna. Aparna had put a video that one female patient asked whether this lady doctor can do the operation. So if a woman doubts the capability of another woman, obviously there is something wrong in the society's perception of women's capability. Now, let me ask Dr. Lakshmi, has she ever faced a situation like this? And if she did, how did she come out of it? Is Dr. Lakshmi around?
Yes.
Yeah.
Initially, when I started doing my own patients, there was a little doubt, but that will she able to do or not. But over time, when your results have to be consistent. Like Josna ma'am said that you cannot do messy surgery, or in the middle of the surgery, just give up and then ask for a male to come and help you out. That may happen initially in your mentorship, but over time, when, that's why I say to anyone that set out to practice when you have the full capability of dealing all the difficult steps and all the difficult complications that can arise. Then, because now what happens is, what you're doing in the operation theater, the patient doesn't know. Patient is anesthesia, patient attendants are sitting outside. What happens in the OT spreads out from your anesthetists, from your OT technicians, from your nurses. So if you are fumbling during surgery, or you're taking lot of time, or they see repeated complications happen, then the bad word goes out. And that's how the people cling to it. So that's why I say that if you have to make a mark, it need not be famous, it need not be that everyone in the world should know your name, but it is that the patient comes to you confidently and says, madam, do my surgery. That only comes from the what result you are able to give. Absolutely. And that purely depends on surgical training. True. Beyond a point, what I have understood is, means we have come into surgery when there were very few lady surgeons who were acknowledged, but still we came in, and then we didn't do female dominated surgical fields. We came into a male dominated, operating on male patients also. Okay. So, but that confidence only comes when your results are always perfect. You can have, if a complication rate is 1%, then you should try to keep it less than 1%. Then only the people will look up to you. And it's not that tomorrow, if you're in a team and a male surgeon comes, asks you to rescue him from a difficult surgery, then you're known that you're made your mark. Yes. So I would say, train yourself to get the perfection. And this also holds for no corporate hospital will take a male surgeon and promote them. I am working in a corporate hospital for so many years. Before me, so many people have come. They may come with lots of fancy things, but within 2-3 months, the hospital sees what their performance is. Same thing, how they behave in OT, how they are handling the case. Every message goes out to the management. And if this person who has come with all fancy demands and all is not able to prove, they're immediately removed from the post. That happens to the males also. So let us not fight at female. We are surgeons. We have taken up surgery as a specialty. Let us try to be perfect in that work, and then we will get our recognition. True. Beyond a point, the patient doesn't see whether you're a male or female operating. Whether I am going out from this surgery alive, happy, perfect, able to return to my work. That is what they see.
I totally agree with her. Attitude of the society is changing very much. They're very they're accepting women as surgeons, as performers. They're good, they accept it. So there is no gender bias.
To make a comment, sir. Sir.
Yeah.
Now, in a small town like Nanded, sir, when I initially started the practice, the society has been trained and they have an imprint in their mindset, sir, that every female doctor is a doctor related with the ANC and the PNC problem, and every female the patient will be seen by a female doctor related with the genital tract. Now, initially, when I came into the practice, the patients of LSCS, patients of ANC, patients of MTP, they used to come to my OPD. Then over the period of 1 month or 2 months, I started realize that what is the problem. Then whenever these patients used to come, I started them giving some questionnaire. And at the end of 1 or 2 months, I realized that it is not the problem with the patient, it is problem with the society. And after that, sir, over not less than 8 years in the Nanded local FM radio, I started a program with no name of mine. I started a program that what is general surgery branch, what are the diseases that are related in the general surgery practice, and even female can also do specialty in this subject. And over the sir, that program has so famous. The name of the program was Me Dr. Bolte. And I do not used to have my name, hospital name, nothing. And over the period, people have started realize that even female doctor can operate on eye, even a female doctor can operate on our hernia. So over the period of 8 years, sir, society came to know that she is not a doctor meant for delivery. She is a surgeon, like a famous surgeon Chidravar in the town. So this is a reality, sir. And after years, that program has been awarded as the best awareness program, and I got the prize for it. So it is the thing, sir, that how you present yourself to the society.
Can I make a comment, please?
Yes, please.
Can I make a comment?
Yes, Dr.
Can I
Geeta,
make
yes.
a comment?
Yeah.
I'm Dr. Geeta Kadevrat. I'm a breast surgical oncologist at Max Hospital in Delhi. So I belong to the northern part of the country where, telling you, I'm a South Indian, born and brought up in Delhi, but I know what is the stark difference between the way the society functions between the two sides. So I'm sure you all must have heard this bit, a sister. So when I was a postgraduate intern, I used to seriously get really upset when somebody used to address me as sister. And you ask the gentleman, I'm also wearing this coat. I've got this stethoscope around my neck. Why are you calling me sister? So, he used to quickly change his this thing and say, sister meaning, sister as in, aap meri behan hai. So, that is where our journey started. So, why when Dr. Manjula just said it is twice difficult, I don't think it is twice difficult. It is many-fold difficult, because you must realize that you don the hats, probably 5, 6, 7, 8 hats, and you're supposed to do justice to each of them. And I'm telling you, most of you would be doing justice to each of the roles that you. But when Shruti said about corporate hospitals, see, when you have to mark, the route is the same, man or woman, irrespective. The route is the same. If you want to make a mark, you have to be good at what you do.
Yeah.
And see, surgery is a small part of it. Let me tell you, if you want to create a mark, surgery is a small part of your practice. How you come across to your patients, how you communicate with them, how, I'm not saying that skills are not important. Skills are very important. How updated you are, how available you are, how accessible you are, all those bits matter. So if you do a better job than your man, but I understand your angst, because I remember when I started work at a corporate hospital, my secretary, so I used to always say anything, any legs in trousers would do, would do better than a woman surgeon, They would not acknowledge women doctors, but anything in trousers would do. So long as it is a man, they would call him Dr. So-and-so, the secretary, but they would be kind of a little hesitant. So it is a process of evolution, and fortunately we have been witness to that process of evolution. And we have seen how things have changed. We have seen how, women doctors are coming to be acknowledged. There are still times, even today, when you worked up the patient, you've seen the patient has come, and then the patient asks, "Acha, aap operate karne wale?" So it's a very shocking thing which still happens. But I think, so the effort has to be, but don't get into this, don't let this thing come into your mind that, he's better than me. You are the best.
Agree.
You have to tell yourself you are the best, and I'm sure you will get there. Thank you.
Thank you.
And actually, Shruti, you're in a very interesting field, transplant surgery, because that's my field. That's a huge opportunity for teamwork there.
Yes.
And it's important for each of us in the team to understand our strengths, continue to be relevant in the team, and that way, the strength of the team improves. So that specialty already gives you that opportunity to be part of a team,
True.
Now that you are there, may I ask you a question? There is a point raised earlier that women surgeons who get married to another doctor probably has a better quality of life because the husband would understand, which I don't agree. If that means a woman surgeon who is not married to a doctor is not likely to have an understanding husband, which I don't think agree. So what would you say? I don't think you are married to a doctor.
You asking me? Yes, I am not married to a doctor, and
That's a gamble.
no, and I thoroughly, I'm happy about my decision in life because it gives that work-life balance automatically. You don't come home where you again have to prove that you as a female surgeon is better against a male orthopedician who comes home. You know, it's very clear here. Your profession is different, his profession is different. We have things to share. So whatever this so-called struggle or trying to prove yourself at work doesn't continue at home. I'm not saying I'm having a difficult time at work. I'm absolutely one of the blessed ones. But when it comes to having a doctor as a husband and a female surgeon, to me, it sounds a little more intimidating.
Thank you.
Your dinner discussions will be more diverse, I bet.
Listen as a point. Dr. Teacher, will you come in? Yes, please. You wanted to say something.
The teacher, you have to unmute your microphone. And
all right. So this is for Shruthi. Shruthi, I hear you're from my alumni. You're from AIMS, right? Yeah. So I'm so happy to see you doing so well. I think what you have to do, and for Manjula as well, you guys are very, you're at the step where, honestly, there's too much information today. I didn't know when I was doing my MCH, all this. And I think that was a great thing for me because I could put my head down and I could just focus on the learning the skills. As you grow further and you get information about the so-called corporates and so-called people who want to do a business with medicine, that's a very different game. So you need to understand from all the people who are here that most of them are independent, strong women who have their own practices. And what they have done when I came to practice in Delhi, I was told by a general surgeon who used to do MIS, and he told me that, Madam, now that you are outside in practice, please understand that the ABCs are different. And the first thing he told me about A was availability, B was bedside manner, and he said credentialing is C, it's third. And I was like, okay, because I didn't believe in that, but I do understand that that is something where we as doctors, and I talk about this quite often, and I think the first thing that we as doctors, we all have to understand that we've all joined a terribly difficult line at the age of 17, 18, and 19. Our system in India is such. So as a result of that, the development that takes place, and if you are so focused and you're going into only one direction and continuously going into that direction, then you tend to be a little bit too focused. And what you don't realize is that around you and around your academic world is economy. As long as you are in a resident post, a senior registrar post, a fellow post, you are needed by the same so-called corporate hospital or the university hospital. The moment you become a consultant, the role reversal takes place. The economy changes. So I always, because I didn't get involved in that economic aspect of life till I started having to earn my own living, I think that it's a good idea to also have some amount of ability in understanding what is considered to be a dirty word. And that is, in medicine, it is that the doctor is asking for his fees or the doctor is asking for payment. That is the dirty word, okay? And this is where it's been my journey of understanding, because for the first 5 years of my practice in Delhi, I used to feel very awkward to tell my patient, please go and make my parcha. So I would lose out on a lot of patients who wouldn't pay me. But as I grew older, I understood from many people that this is something that doctors have to understand. So I will lay out what I think is there. You are not only a doctor, you are an artist. Now imagine if you are an artist and you are making a beautiful painting. It's up to you whether you want to give it for free or whether you want to put a tag on it and put a price on it. You may not get the asking price that you have, but you could negotiate with somebody who is wanting to buy it. Sadly, what we give as women surgeons is first information, and the second is the action of the work and then the healing procedure and everything. So I would only say that value yourself well. You are worth it. If you value yourself well, you realize that you are talented, you are amazing women. You are going forth in a field which has been male dominated up till now, but there is nothing to stop you from going forward. Don't get deterred by everybody turning around and saying this, that it's a male dominated world and women don't get paid. Arey, challenge hai to climb karenge na. Why did Mount Everest get, and this is in May, by the way, and by my friend's father, Tenzing Sherpa and Edmund Hillary, why did they really climb that mountain? Because it was there and it was a challenge that it presented to the whole world. So everybody has small mountains. So don't look at fame, don't look at how well known that person is. Not important. You should go happy you've done the best. You should go happy thinking that, okay, I've done very well. And once you're comfortable with that, you know, everybody's reached a stage where they can show their results. When you start, you may not be able to show your results, but you should be comfortable that, yes, I've done a great job. Today I can go and sleep well, or today I can go and buy myself something nice or something. So don't miss that part of yourself. Don't suppress that part of yourself, but don't underestimate. Your colleague who's a man is under similar stress. He is, like somebody mentioned amongst us, he has to earn the livelihood for his, so his
some of them are sole breadwinners
yes,
of the family.
Yes, so his generation, the generation of his power is this absolute need and hunger. Somehow women are not that aggressive. Yeah, you know, surgeons are supposed to be aggressive. Somehow women surgeons are not that aggressive. But you must understand, these are words that I have understood over time, that it's your talent. You are an artist. Don't let any corporate house tell you that you are less than a man. It's not that we are equal in terms physically we are not. In responsibility we are not. But we are equal in terms of asking for equal opportunity, asking for equal pay. So I think what I can only tell you guys is, when you're younger, you get bogged down. It's very scary because you took that decision when you were 17 to do medicine, 22 to 23 you had surgery, then 25, 26, I'm sure this is the age group, 26, 27 you decided, oh, super specialty. You know, now you're hitting 29, 30, and shit. Sorry, excuse me, but this is what it really happens to a woman who is taking this life. And if you haven't got children, the support of a family or a husband or economic backing or something, you wonder whether you made the decision. But let me tell you, you have. Okay, let me tell you, and please understand, if you have taken the journey so far, don't get worried about the rest. And if tomorrow you choose to drop this and do something else, do it. So just be empowered enough to know that you have it in you to do whatever you want to achieve. Nothing is going to stop you. Nothing can stop you. It's your mind, your brains, and all the women who've done it. Like, you know, I'm so impressed by so many women who I've never met before in my life. I've only heard of Dr. Geeta, who's a breast surgeon at Max Patparganj. I see her today and I see, wow, you know, she's very popular in Delhi and she's very well known also for her work in Delhi. So I think the only thing I can put forward is, like, everybody has challenges. Everyone is going to be challenging you every day of your life. But you're not going to be coward and sitting down and say, oh, you know what? No, you've come through so much. So listen, my mistake also, because you only look at with fear, with anxiety, what's ahead. You don't realize. And so one day I'd expect all of you to sit down and put down your achievements. For the younger generation, put down your achievements. Class 12, first year, second year, then the profs, final year, internship. You put down, you just sit down. You know, that's why the logbook is so important for everyone. You look at your logbook and say, wow, I did this. I accomplished this. So appreciate yourself, pat yourself on the back. Sometimes there's nobody else to do it for you. I mean, I do it to myself. I said, wow, I did that. I survived. So I think that's what the mode in which we are at. Every day that you wake up, you tell yourself, I love myself. I've accomplished so much. I think that's the only thing as advice I can give you, because, you know, economics is something that I can only tell you that every day appreciate yourself. No, if nobody else, it doesn't matter. Look at yourself and say, I love you. Man, I really love you. Oh, not man. Woman, I really love you.
Excellent. Thank you.
I agree, ma'am. And there's no worries. There's no negative thoughts, no negative feelings. Just that there still needs. I mean, there still is something which is left to be achieved. That you know, we need to keep it in the mind.
Absolutely.
Of course.
Yes.
Okay.
And if I can,
I'll go a little off track.
Okay.
I notice in the crowd of people who are watching this program live, we have Dr. Sushma Sagar. Many of you may know that she's in AIMS. She is one of the major pillars of trauma surgery in AIMS. He is here. I want to make a statement. What she has in Women in Surgery, a Perspective from India. That was in 2016, 4 years ago. She has written, only a hardcore woman who is passionate about opting for surgery can face these challenges bravely by gulping the tears rather than them overachieve. Attire, manner, language, build, and height of women surgeons are often more discussed than her surgical skills, hard work, and punctuality. The atmosphere in the OR and duty rooms is often so unpleasant and audible that pushes you out of the place. So, may I ask Dr. Sushma to kindly come on and give your views?
Thank you so much, and it is a pleasure to hear from so many stalwarts. And it's very true that we've been in the group and we've been listening the comments each day, but never got the chance to see each other. And Shruti, I am a trauma surgeon, and you know it is like said that trauma surgery is like Karela or wo bhi neem chada. You know, and moreover, you know, you are doing all amputations, degloving, max fax, and everything. So like everybody has said, it is, you know, your passion, your aggression, and your dedication that keeps you ahead. You have to work little hard. And the beginning, I know things look not so very glamorous in the beginning, and you feel like bogged down by people surrounding you. But time will come, and definitely, you know, today I am like I have so many MCH residents under me, and you are working at AIMS, so you know how the atmosphere there is. And
I'm not working at AIMS anymore.
Life is a pleasure. I mean, once you reach, you cross those hurdles, then life is a pleasure, and your patients, your everybody who's around you, they start believing in you. Rather, they would prefer to come to you because, you know, there is an added element of passion and compassion. I mean, you are more empathetic towards your patient. You are more sympathetic. You can listen to your feelings. Their family confides in you more than what they confide into a male surgeon. So there are certain attributes, you know, which only a female surgeon has. So that's all I want to say.
Dr. Sushma, I want you to say what you wrote 4 years ago. You still have the same opinion that the atmosphere in the OT is not very conducive for women surgeon?
See, in the beginning, it is always there, but then you have to take hold of things. You know, you have to tell them that, listen, I am here, so please mind your language. Or maybe you can tell them that this is not political. So, you know, what happens these days is like if any colleague is speaking any harsh words or any gali or something, they would say, sorry, ma'am, it's not political. So, or I am using a political language.
May also take this opportunity to bring in rather unpleasant. Sexual harassment in workplace is common across the board in all branches. Do women surgeons feel it, or at least the beginning of the career? If so, what would they advise the junior people so that I don't want to give up surgery because of this?
No, yeah, it is there, and I have had my junior residents coming to me and telling me that this is happening. Their senior residents are not behaving properly with them. Then I used to call those senior residents to my office. I used to discuss with them, and there are times when we had to suspend one senior resident because of this. The things are happening, you know, but then you have to be vocal about it, and you should not let them interfere into your work. I mean, I can only suggest that you need to be vocal. You have to come out of that thing. The time has gone when you have to simply bear with all those unpleasant things happening in the OR, and OR is one place definitely where these things do happen, and especially when you are younger and when you are in the beginning of your career. But now, fortunately, you will have one or two shoulders whom you can go and speak to. Earlier, about 20 years back, you were alone among a batch of 11 or 12, then things were difficult. Now, all my colleagues can say that there are many mentors who are available, and you can go to them and you can speak about it. And do not let this happen to you anymore, especially to the extent that you are leaving your branch. No.
Thank you, ma'am. We have lots of senior faculty people. I would ask them, how would they sensitize male colleagues to avoid such unpleasant situation in workplace? May I start with madam? Madam has had no problem with men.
Me, you're asking me? Okay. So, first is we have, as our postgraduates, you know, when we have our postgraduates, we must tell them, you know, the responsibility with which they have to handle women at workplace. This is something as part of our teaching. We are teaching ethics. We are teaching other things also. So as part of our training, we must also tell them and we must share with them our own experiences, how we have been handled by our associate professors, our colleagues and things like that. So this is one way of teaching our juniors how to handle their lady colleagues, the women colleagues. There are a couple of times when we also had, like I was a professor and I had to handle a big war with that was going on between a postgraduate, a male postgraduate and a lady postgraduate who had come from Kerala. There are a lot of fights and other things, and using some abusive language and things like that. So we have to call them over to the room, and then I had to take like a lot of counseling sessions. I had to give them probably 6 or 7 counseling sessions I had to give them. And then they become very friendly. After that, they were very cordial, Most of them, see, these are all personality disorders that are there. So not only you should be a good mentor, you should be a good surgeon, you should also be like a psychologist or, a support system you should give to your junior colleagues. As far as me, luckily, we were 3 women postgraduates when we were studying in the same unit under one chief. And most of the colleagues were our classmates only, the male colleagues. So I did not have any problem. We did not face any sexual harassment or anything at our workplace. So I think
I have a question, please. Permit me. Are senior lady surgeons mentoring junior lady surgeons enough? Because we have seen in, pardon me if I am wrong, gynecologists, for instance, that they're more friendly or more conducive to boys than girls. Does the same thing exist in surgery?
This question I like to answer because I have had.
Ma'am, you are a pole apart. I want others to answer.
No, give me one.
For you, everything is nice, madam.
No. Regarding treating the women postgraduates, by the lady surgeons, I think I think you should take a survey of all the lady postgraduates who studied with me under my whatever as an assistant or thing. They loved me. I think women have definitely a special corner for lady postgraduates.
Any dissent in this opinion?
Can I add something to this?
Is training people.
Yeah.
Dr.
Yeah.
Can I add something to this? Yeah. So 2011, when I was in my second year of MS training in PGI Chandigarh, we did not have any female consultant then. Most of my male consultants were very good and, they were encouraging, but then I was really looking for a female role model. I had some female, postgraduates as my seniors, but then I did not have any consultant, and I was looking to go into a field where I did not see too many female surgeons, GI surgery, GI HPB surgery back then. So I ended up writing a mail to Dr. Julie Frieschlag. She is the famous vascular surgeon in US. She was the president of Women in Surgery, the very famous surgery, women's surgery, group, the association in US. So I ended up writing a mail to her just to tell her that I'm so happy to see some women in a leading role, and I was just wanting to have a nice conversation with her, and she sent a very nice reply saying how things have improved in US over the years and what kind of efforts that they have taken from the Women in Surgery group. So giving this, and also with the concept of having role models for postgraduates or any kind of junior doctors who are looking for role models, can I make an appeal in this panel? I see that there are so many senior surgeons here. Many of them would be members of ASI. ASI does not have a women's association, no women's wing. I think it existed for a couple of years and now it's not active anymore. I mean, forgive me if I'm wrong. I could not find any online activity of this. So is there a necessity to have something of that sort, not to subgroup, not to, make things different for women surgeons, but just for this particular thing.
Okay, you got your point. Lakshmi wants to respond. Yeah, she's nodding the head the opposite way. Dr. Lakshmi.
No, I don't think in again a surgical society group, you have another female group and this group and that group will not, it'll increase the rift that between the male and the female surgeons. I'm saying to all the lady surgeons, first take it out of the mind, I'm a female. Take it out of the mind. Once you have come into the hospital.
No, I'm not saying for that purpose,
I'm
ma'am.
saying not male, not
speak,
female.
Yeah.
Be unisex, think unisex. And also, also what I request to all the young ladies we are seeing is, when you come into the hospital, it is your work which should speak, your patient care which should speak. Don't do anything to attract male attention in any form. It could be your hair, it could be your makeup, it could be your dress. I am seeing that now girls who are, I'm saying girls in general and those especially in surgical department, you need not dress that way. This is a professional thing. When you go to practice law, you're supposed to wear a certain dress. So camouflage and only let your work speak. That will reduce the amount of sexual comments or sexual harassment. I would say that they have made me chairperson for the anti-sexual abuse group in my hospital. And they actually said that it's not only from the OT, but from the whole hospital, the number of such incidents have come down. I have not gone and spoken to anyone. So you yourself have to be strict. See, because that sexual attraction or sexual nature is a natural thing. So if a female has put efforts to look glamorous when coming to work, automatically there will be a couple of males, we cannot say all are saints or all are bad, who will pass some lewd comment. So first is for girls, when you're coming to work, especially in this, don't do anything apart from your work to speak. And then what you are saying is again having a female group and a male group, that will again spoil, it will increase the rift. I will never join, even if they're going to do a ASA female group or a IAGS female group, I will never support it. I say let it be a unisex group and you come and present your work there and stand on the podium and get accolades.
Ma'am, again, I agree. It's not for subgrouping.
I would like to interject. I would not say that, because you are a surgeon, you're a lady surgeon, you should be keeping your desire to dress well just because, some man out there is going
dress
to be...
well is different, ma'am. Dress well is different. Dress to attract is different. That we also know.
No.
You
So
wear
dress
your
to attract,
clothes, keep your hair proper, prim and proper. How a male surgeon would come to a hospital? Please come.
No, but
that way. Professional attire.
If a lady were to wear trousers, she can look glamorous in trousers. She can look glamorous in a sari. She can look glamorous in anything. If you want to attract attention,
no, it's not looking glamorous. It is. I am saying that it is.
She should not come in a mini skirt.
Yeah,
okay?
there are
That's what we
who
mean.
come-
There is a difference.
There is a way of wearing a sari, there is a way of wearing trousers, you wear skirts.
Unless she is asking for it.
Comment, Baskaran and myself can comment in that area, but we will
Unless
not.
she is asking for
we'll
it.
move on. We'll move on. Baskaran, you got 15 more
Ma'am,
minutes.
I believe any serious surgeon is aware of how to conduct oneself in the workplace. Anyone who's serious about his or her work, whether it's a male or female, knows all these social skills which have been mentioned in the present comment or in the past
Then
comments.
you will not fall into trouble.
No, that is, I'm not talking about sexual harassment, I'm talking about role modeling.
Dr. Shruthi, I would like to comment on this. Now,
Yes.
I am working in Maharashtra. Now, we have a Maharashtra state chapter. Maharashtra state chapter has many legendary personalities, and presently the ASI president is Dr. P. Raghuram, and the incoming president or present vice president is Dr. Abhay Dalvi sir from KEM Mumbai. Now, this issue of forming a women's wing in the ASI or Maharashtra chapter was discussed, Many of the people who were on the body were pro also, but they asked, you give us 10 valid reasons that by forming this women's association, what difference you are going to make. Now, my question is, once you have given equal opportunity, you have proved yourself beyond doubt, you have achieved the skill, then why you want a different seat? You have to enjoy within the same bus. The journey is yours. How you enjoy. So it is, the thought process is not going to differ in which seat you are sitting. It is equal opportunity is coming to you. You just have to pick up and act and give your 100%. That is my opinion.
Thank you. I think
it's not for subgrouping. It's not for subgrouping.
See, the role model is a desirable thing. In fact, lots of people believe that they take up surgery or gynecology or any other branch because they see a role model, and the inability to have adequate number of women role models was deemed to be a reason for women not to take up surgery. However, a scientific study done in the US showed that is not the actual reason. The actual reason has nothing to do with the role model. If you have a role model, it is an additional factor. But what deters women taking up surgery is a different thing. Now let's move on to how we can improve women joining surgery. What all can we do? Can we make surgery more attractive? Do you think we should give them some leniency, like somebody said, that they can be given free time, they can be given lenient time, of course, permitting the work without others getting loaded. Okay, can we have the opinion of the panelists, Dr. Nanda? Is Dr. Nanda around?
Sir, Baskaran, sir.
Can you hear me, doctor?
Yes, I can.
Yeah. As such, during surgical training,
interesting for women, and also give them leniency when required.
No, during surgical training, there cannot be any leniency at all, because surgical training has certain rules and regulations, and if you do not follow that, you do not get adequate knowledge, you do not get adequate skills. So if you want to have adequate skills and knowledge, which is a must in surgical specialty, you cannot have any lenience in the 3 years. So only way is learn to delegate your work, add family, and take help and support from others, and that's it. That is only by your conduct you can do that, and we cannot give any lenience. But once you complete your training period as a surgeon, then you have definitely a choice which specialty you want to take. Because if you want more lenience, take a different choice. If you do not, like for example, if I wanted to have another child and it would give a big break to my career, then I wouldn't want to have. This is what decision that we all take personal level. So we just have to decide how taking your own decisions, personal decisions, is going to support you. So when it comes to a very skilled surgeon, let us say if I have to work in any corporate hospital, I want to work only so and so much time. Yes, that lenience can help me a lot because I want to only work that much time. But in institutional practice, that doesn't work. In the private practice, it can work. So I think we can make a choice on whether we can build our surgical practice only after we complete our proper training period. So there cannot be any lenience during proper surgical training period. So that cannot be reason to make women get attracted to surgical specialty. Only way for women to get more attracted to surgical specialty is by making them understand that this specialty is like any other field, except there can be some kind of excessive physical work that is required. So if she has enough physical stamina, then she is fit to take surgical specialty. I don't see any other reason other than physical stamina that whether she is fit to take surgical specialty or not. This is what I like to say. Yeah.
Thank you. Dr. Tichan also pointed out, we discussed in one of the panel discussions earlier, surgery is not a favor subject these days. So we'll have to make it more interesting. Can I ask Colonel Geeta to come up and say, how can surgery be made more attractive to people, not just women, to everybody?
Uh, Sir, as I was going through the discussions, I was just thinking that the main reason why women are not there in surgery is, yes, like someone said, we do not have role models. So it is on us, the surgeons who are there, the lady surgeons now, to become role models for the younger generation, to to encourage them to take up surgery. And and they just need to know that there's nothing great about it. You just have to be sincere during your learning period. You just have to be humble as a person, and you will always be successful as a surgeon. That's all is required. And you need to have a passion for surgery. Then the world is your oyster. That is what it is. So we basically need to role model ourselves as we mentor youngsters to take up surgery, whether it is a lady or it is a male. That's what I feel, sir.
Baskaran, the last 5 minutes, I have one question. Please allow me. You see, I want from every panelist a word. They want to tell the male surgeons, which they wanted to tell them all their life, but they couldn't tell. To the male surgeons, something you want to tell them on their face, but you couldn't tell because you never thought. This is a platform because men should know as to what is on what ladies think.
You want to say
to everyone, not you, Baskaran.
Language.
Yes.
Yeah, who is going to tell that?
Men should realize that we are here to stay. They cannot take us for a ride. We are very serious about it when we take up surgery.
We don't know that. I don't know how many people know Dr. Jyotsna is married to a well-known urologist, but he is referred to as Jyotsna's husband. He is not known by his name.
No. It's not true.
Yeah. Yes, others.
So I would like to answer. Yeah, ma'am.
Sorry, no, whoever said. Please go on. Okay. Last year we had a 50th golden anniversary at AIMS of the Pediatric Surgical Department. And while one of the meetings was going on, it was my old head of department. So he started off and he was like, Abna, I said, sir, yeah, it was so difficult and all. He said, look at her. She's now going to say that I tortured her. I started laughing. I said, so why should I say that? I tortured you. And everybody started laughing. I said, no, I'm not going to play the victim card ever. I won't. I refuse. So while the male perspective is that now he's retired and he probably thought that I was going to come back and turn around and say that, yeah, aise hua, waise hua. I mean, all of us went through the same grit at that point in time. So I said, no, I'm not going to say that. I said, I tortured you. Because, I mean, can you imagine how irritated a person of his caliber, professor, head, would have been trying to teach somebody who's like years younger. So he expects somebody to understand his mental level, and you are just too young and too inexperienced. So you develop that as you grow older. So now not only that, but I developed as I grew older that, you know what, I am taking the power in my hands. I'm not going to turn around and say that, okay, it's tough. Yes, it's tough. You have to do it. But then so many things are tough in life, right? So you just do it, emerge successful. And it doesn't matter about your clothes. It doesn't matter about your appearance. Be beautiful. Yeah, that's what I realized in Australia. That's what I realized, that the women were gorgeous. They'd walk around sleeveless in straps and whatever it is. They couldn't give a damn. And I can't do it today because it's inculcated in me from a very long time. Oh, you have to dress like this and like that. But I love this particular neurosurgeon, Greek woman, all with her hair open and walking around, giving no damn about what the guys were saying about her. She was there. She was completely there. And I said, these were goddesses. And so today I say goddesses come in different formats. We just have to respect each other. No judgment, whatever you want to wear. Because like somebody has posted, if somebody wants to harass you, you could be wearing a burlap sack and that person will still harass you. So, live your life as a woman as well. That's most important. Don't forget the primary thing, that you're a woman. You have to be whatever, everything put together, everything.
Excellent. Thank you. Dr. Gomathi, would you like to say?
Well, this is not just for male surgeons, because, once Dr. Radhakrishna gave this question, I kept thinking, what would I like to say? Men in general. I mean, if a woman is, if a woman is going to say filthy things or pass a sly comment like a guy is going to be really nasty. And if they're not doing it, they're not doing it because they're polite and courteous. So don't take it the other way.
Thank you.
Nice,
But I have one point to make. When we enter our place of work, why don't we leave the gender outside and just go in as surgeons? Won't it be easier for everyone concerned?
I think all of us do that. I think all of us do that.
I think most of us felt that when we started and feel that when we finish.
Yeah.
It could be because a few of us are quite, probably a few years into it and we've forgotten the early difficulties which our younger surgeons said. But at the end of the day, those things really don't matter. At some point in life, you think they're very important. As days go by, those don't matter at all at the end of the day.
I have a feeling that some young women in the beginning want to be treated with kid gloves, and when they don't, probably that is when they probably feel very unhappy and probably leave surgery, or for that matter, any profession. What do you say?
No, none of us felt that.
No, that's why you're still there. Others are left.
Baskaran, I'm afraid we need to wind up. It's 8 o'clock.
But that's true about any specialty.
I think
Not
we
just
had a
surgery.
wonderful discussion, and eye-opening things have been talked about, and it's so nice to see so many flourishing ladies and who've done very well in their career. And I leave it to Baskaran to conclude, and we need to call it off.
Thank you very much, all the ladies. It's been wonderful discussing with you. We have a fantastic group of people who contributed to the discussion. I mean, there are so many great people. You are all role models now. I'm sure a lot of people are going to ask you to be a role model. Tell them, please encourage people to join surgery if they like it. There's no point in taking up surgery if you don't like it. Yeah, no, it happens now that people who make it in need do not get the specialty of their choice and sometimes land in surgery. And I think many of these people will get off the vehicle halfway through. If not immediately, after MS. There are any number of people who after their qualification do not practice medicine or surgery or whatever they do. And this percentage is much higher in women. It is evidence-based. There are any number of papers, statistics, and I would like to thank all the panelists for their contribution and making it very lively. Thank you very much. It was very nice and great fun having all of you. Thank you.
Thank you so much.
Thank you all.
Thank you.
Thank you,
everybody.
Thank you very much.